Welcome back. South Africa's response to the COVID-19 pandemic has been marred by claims of irregularities and corruption in terms of tenders. And now the Health Department is under the microscope. The Special Investigating Unit is probing a contract with a little-known communications company, Digital Vibes. The Daily Maverick earlier reported that Digital Vibes had received 82 million rand over a 9-month period, and two long-term associates of the Health Minister, Dr. Zweli Mkhize, scored consultancy deals with the company. Now, earlier the minister said that he had been advised early this year that investigations were going on and that the Auditor-General had raised concern about this company. He said he fully supported the Director-General's view to go ahead with an external probe, and the results of that investigation will be revealed publicly. Let's discuss now. We're joined by the SIU spokesperson, Kaizer Kyanyago. Mr. Kyanyago, thank you for being with us. So the Daily Maverick has reported on this, but I understand you received a complaint independently. Was that before or after the Auditor-General raised its concern, or is it linked to what the Auditor-General found?
No, we got the anonymous whistleblower not so long ago. I think it was just in the past week. And then we started looking into it, and it is not something that was linked to what the Auditor-General said.
How far are you with the investigation?
No, we have started the process where we have sent a letter, which is a 52C letter to the Department of Health. And today, one of our officials went to the department, and we are getting a lot of cooperation, especially from the Director-General, who has promised to give us the documents by tomorrow. And then we'll be able to move and then look at the documents that were used in the process of this tender or the procurement process.
Was the SIU a bit slow off the starting blocks here? Because it seems like this has been around now that the Health Minister has spoken out. He said that he was informed earlier this year that the Auditor-General had raised the red flag, and that the Health Department itself had decided to do an external investigation. So you're saying you only became aware of this in the last week or so?
Yes, you must understand that the Special Investigating Unit doesn't just go around sniffing for where problems are. We deal with all our investigations are allegation-based, and all our outcomes are evidence-based. Therefore, if there is nothing that is reported to us, we cannot just go and say we feel like there is something that has gone wrong, because then we'll spend all our time sniffing that. Therefore, now that there is an allegation sent our way, we are now in a position to then take it up. At the time when it was found out, like you are saying, by the Auditor-General, nobody reported that matter to us.
And does it matter
Maybe
to
they
you?
wanted to.
Yeah. Does it make any difference to you that the Health Department is doing its own probe? You'll still go ahead with yours. Will you ask them for information if they've got it?
We are going to go ahead with ours because we are looking at all the investigations that has to do with COVID. And that falls under the proclamation that we have already, which is R23 of 2020. Therefore, if the other investigation has not started, maybe we might ask them to not continue with it, because now we'll be doing the same kind of work on the same kind of contract.
On the face of it, can you explain to lay people, does it look like something is wrong here? Firstly, people are talking about the size of this PR communications agency, Digital Vibes. Where's the rule that says a government department has to use a very big communications agency?
Yeah, we cannot say that at this present moment and talk about face value. But what we can say to the public of South Africa is we're going to look into the process that was entered into, whether it was value for money, whether there is no collusion. We also have to look at processes like whether that doesn't have to get approval from GCIS, who has got an agency, a media buying agency, for example. Yeah. Therefore, we'll look at all of those dynamics and make sure that everything was done according to book. At this present moment, we are not saying anybody has done anything wrong. We are saying there is an allegation that says that people might have done wrong, and we will investigate it and get to the bottom of it, and every stone will be turned and we'll check underneath. And once that is done, we will make sure that we tell the public about what has happened. The head of the SIU has made sure that we prioritize this particular one, and we will be able to try and push it as quick as possible.
Are you able to tell us more about the claim? Because this agency uses the services of the former personal secretary and the former spokesperson of the Health Minister himself, Dr. Zweli Mkhize. Is there a claim that the Health Minister tried to influence this to ensure that his friends, former colleagues received lucrative work?
That is one of the things that are in the allegations. Therefore, we'll have to then go and prove whether it is true or not. Because the allegation is about that, which is the collusion that I was talking about. And it's also about the fact that the process of the appointment of this company was not done properly. And all of those we will look into very quickly.
The good reputation of the Health Minister is now being questioned. I think this is disappointing for many South Africans who have commended his work on COVID-19. So are you saying that the public right now, basically we should keep an open mind?
No, we are saying we do not delve into the realm of accusing people. We look at the allegation that comes before us, and we are saying anything can happen. There are instances where allegations were made to the SIU. We investigated the matters and we found that there is no merit into it, and we closed those cases. Therefore, it doesn't necessarily mean all the time when we investigate we are going to find something wrong. But in cases where we find something wrong, we will go all the way and do exactly what we are supposed to do. If there is money that needs to be recovered, we'll recover it. If there is disciplinary hearing that we need to refer, we will do so. If there's criminality that we need to refer, we'll do so. But from where we are sitting, we always move from the premise that there is an allegation, it is substantiated, let us then go and investigate and get to the bottom of the facts.
Very quickly, can you give us any sort of timeline? You said you will try and do this as quickly as possible.
At the moment, I think once we get the documents tomorrow, we'll be able to determine the time, because I know if I give you a time after that, maybe let's say I say 2 weeks, at the end of the 2 weeks, you'll be here on my case saying, you said you're going to finish. It will be determined, but all I can assure you is we will do it as fast as possible. I always give people an example to say, when the lockdown happened, there was that investigation we were doing with the IT tender in Gauteng. We finished that in about 2.5 weeks.
Okay, that's a good timeline, but we won't hold you to anything. Thank you very much. Spokesperson for the Special Investigating Unit, Kaizer Kyanyago.